The Accuro is powered on by pressing the power on-off button. After the Accuro finishes powering up, the home screen will appear. From the home screen, there are 3 different presets from which to select: spine, bone, and soft tissue. The home screen also provides access to saved images in the gallery. This will be demonstrated later. The Accuro device settings can be accessed using the Settings button on the bottom right. If using the Ravenna Locator Needle Guide, then place the locator onto the Accuro. To guide a spinal or epidural anesthesia-related procedure, select the spine icon. This preset activates the Accuro's SpineNav 3D technology, which automates identification of epidural location and depth. Once the spine preset is selected, apply ultrasound gel to the lumbar spine area and scan in the transverse orientation, taking care to hold the Accuro perpendicular to the imaging surface. Adjust the brightness and zoom controls as desired. These controls are semi-transparent until touched by the user. The SpineNav 3D midline indicator is the dashed vertical line on the image screen. Use the midline indicator to center the Accuro on the spine midline. With the Accuro on midline, scan along the lumbar spine region until the interlaminar space is automatically identified at the desired intervertebral level. Note the depth shown on the screen. Automated identification of the interlaminar space on midline is indicated by a red bolded midline indicator and crosshairs aligning with the interlaminar space of the 3D spine indicator. Disengage the Accuro Locator Needle Guide and press gently against the skin to mark the location. If Accuro Locator is not used, then note the skin position corresponding to the middle of the transducer face using a preferred method, such as a surgical marker. Prep the needle insertion location and perform the injection according to standard protocol, recalling the depth conveyed in the SpineNav 3D scan. The Accuro can be placed to sleep by tapping the physical power button. The device will wake from sleep rapidly when it's time to use the Accuro again. To power down completely, press the power button on the home screen. Do not hold down the physical power button to turn off the Accuro unless absolutely necessary. Scanning with the Accuro can be performed using the Accuro Sterile Instrument Cover Kit sold separately. Sterile gel included with the kit is injected into the sterile cover. The Accuro is then placed into the sterile cover with the screen fully extended. At this point, the tab on the top of the sterile cover can be removed and the 2 ends of the cover opening can be joined together. Finally, rubber bands included with the instrument cover kit are placed over the hand grip region to ensure a tight fit of the sterile cover over the transducer. With the Accuro Sterile Instrument Cover Kit, sterile scanning can be performed while still operating the touchscreen. SpineNav 3D identifies anatomy in the transverse orientation only. For other orientations, turn off SpineNav 3D overlays or scan using the bone icon from the home screen. If the scanning angle is too steep, then only spinous processes will be detected. For proper identification of the interlaminar space, arrange the scanning plane angle to be perpendicular to the spinal anatomy. Saving an image to an examination file can be easily achieved during live imaging by activating the physical button on the hand grip region of the Accuro. Alternatively, an image or video can be saved by pressing the pause button and then pressing the camera or video icon. From the paused image screen, the patient information can be entered to associate it with the saved image. After conducting the exam, the saved image can be found in the exam gallery. Patient information can be further modified. A saved image can be exported to a report by first connecting the Accuro to a Windows computer using the micro USB to USB cable provided with the Accuro. On the Accuro device, from the home screen, select the Settings button. In the Settings main screen, select USB Storage and press the Turn on USB Storage button. The Accuro Atlas program will auto-run on the Windows computer. The exam of interest can be located from the Accuro Atlas home screen. The icons to the right of the exam will generate a report. By clicking on the exam, the Accuro Atlas software provides various options to edit patient information and customize the report. A quick start guide for Accuro Atlas can be accessed by pressing the F1 key on a keyboard or by navigating to the Help Documentation menu.